Jaundice is the medical term for the yellow discoloration of a baby's skin when they have too much of a substance called bilirubin in their blood. Jaundice is a really normal part of being a newborn, and about 85% of newborns will look at least a little bit yellow in the face. This is because that bilirubin that I mentioned is a normal byproduct from red blood cells that are going to be released into the blood. When a newborn baby's born, they don't need their fetal red blood cells anymore, and so the body breaks them down, and this bilirubin kind of is in the blood briefly. The liver has to process it and push it all out through their urine and stool, and sometimes immature newborn baby livers can take a few days to do that. So babies commonly look jaundiced even for a week, sometimes 2 weeks at the beginning of life. Jaundice is common, but it can be dangerous if those bilirubin levels get too high. For the majority of babies, it's just going to be, oh, they look a little yellow, they act fine. But if those bilirubin levels get very high, the bilirubin will actually deposit into the brain and make the baby sleepy. If the bilirubin has gotten into the brain and made the baby sleepy, then they're not going to want to feed as well. And if they don't feed as well, they won't poop and pee as well. And you have to do those things to get rid of the jaundice. So it's sort of a cycle where being more jaundiced makes you not eat as well, and then that will just make the jaundice worse because your body has trouble getting rid of it. It's kind of tricky because jaundice actually usually peaks around day 3 to 5, which is right after a baby has left the hospital following their birth. That's why it's so important that we bring newborn babies back into the clinic just 1 to 2 days after discharge to see them for the first time. And if they're looking a little jaundiced, then we may actually have them come back for a few days in a row to keep an eye on that level. If a baby's jaundice levels are too high and they are having some risk of negative outcomes, that's where we're going to start phototherapy. Phototherapy is a special wavelength of light that helps change the bilirubin into a form that's more easily released through the urine and the stool. And that's usually done at home nowadays, which is great. It's actually quite convenient because it's just usually a little wraparound, kind of light up blanket that can be worn with clothing over it or a blanket over it, and comes with a pretty long cord. So you're still able to move your baby around and feed very easily. Rarely do we have to actually hospitalize a baby with jaundice nowadays, but sometimes that is needed if they need more intensive phototherapy, or if the baby's also very dehydrated and might need some IV fluids.